The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Like everybody in this room, everybody watching agrees that the cost of health care is too high. I'm a doc who worked in a hospital for the uninsured and the underinsured for decades, and I have seen patients struggle with health care bills, but to limit it to those at a hospital for the uninsured would not do justice. I've seen middle-income families struggle with health care costs. So to make health care affordable, Congress must make a serious effort to navigate a whole kind of raft of perverse incentives throughout the health care system. Now, this includes taking a look at health insurance benefit design, the impact of price transparency, regulatory barriers, the negative effects of government discount programs, the negative effects that they have on the prices that Americans pay in the commercial market, and I could go on. And why? It's important to realize that American workers' wages, their take-home check is not growing because more of the check is going towards health care. That's pre-tax. They never see it. So they don't get it in their pocketbook, but it's being sucked away. If we want to increase wages in this country, the number one thing that we have to do is to tackle health care costs. That is pro-worker, pro-family, pro-patient. Now, a key part of this conversation is the employer-sponsored insurance, or ESI. That provides health coverage to over 160 million Americans, and that is over half of all Americans who are not on Medicare. Now, over the past decade, health benefit costs have risen dramatically for employers and workers, and as I mentioned, resulting in lost wages. I hope that the committee can address ESI in a bipartisan way. When we work together, we can have a powerful impact. Now, there are many actors within the healthcare system, and it's really interesting whenever you talk to one of them, like, what's the problem here? They always point to the other guy or the other gal, but it's like never pointing at themselves. And so what we hope to do here is recognize that the problems are diverse, they're intertwined, and just as Christmas lights can't be untangled with a pair of scissors, that we look at the root causes of the nation's healthcare cost increases and attempt to tease them out. We need substantive bipartisan reforms to realign the healthcare system to give the patient the power. Now, the committee has a long history of working together to achieve this goal, and last Congress, Senator Sanders and I worked together on a PBM Reform Act addressing misaligned incentives affecting PBMs and to lower the price patients paid for prescriptions. I tell people when I go to church, and I got a Bernie Sanders supporter here and a Donald Trump supporter here talking about the same thing, usually it's about healthcare costs or prescription drug costs in particular. So Bernie, you make it to my church, man, you know what I'm saying? So now the president is committed to reevaluating the role of PBMs, and I would argue we as a committee should see this as an opportunity to get this signed into law. We all agree that price transparency is important. Senators Marshall and Hickenlooper are leading the Patients Deserve Price Tags Act, codifying price transparency rules issued during President Trump's first term, requiring hospitals and insurers to publicly post the prices they charge patients in a machine-readable format. Another area of bipartisan interest is the 340B program. The common understanding among legislators, whether true or not, their understanding is that the discounts received by hospitals are supposed to make healthcare services more affordable and accessible for low-income and uninsured patients. But the law is actually unclear, and some hospitals do this and some don't. In fact, many don't pass discounts on to patients, requiring them to pay list price for drugs when the hospital itself is getting a markedly reduced cost. In fact, a recent study by the National Pharmaceutical Council found that 340B may make employer-sponsored insurance more expensive, costing workers an estimated $4.5 billion from 2017 to 2023. So not only are the discounts not passed on to patients by some, but there is, if you will, an hydraulic effect. If you decrease the profit the pharmaceutical company makes there, they jack up the price over here, and that over here would be the commercial market for the employer-sponsored insurance sector. Put simply, patients pay more. Beginning last year, my staff and I conducted an investigation into how healthcare entities use 340B revenue, and we recently released recommendations to improve transparency in the program. This is an important topic to consider if the committee wants to comprehensively address healthcare affordability. My colleague Angus King once said, "There is no silver bullet for some issues, but there is silver buckshot." The purpose of this hearing and the responsibility of this committee is to look at that silver buckshot. Now, for the record, I'm not really talking about shooting a gun at anybody, but I am saying that if we can look at the different ways that on the margin we can reduce the cost for the consumer, for the patient, for the employer paying for the insurance, then that marginal cost put together becomes significant, and we're saving money. It's pro-worker, pro-family, pro-patient. Now, we will have to tease apart that web of perverse incentives if we wish to find that silver buckshot. I urge us to put aside politics to deliver for the American people, and with this, I recognize Senator Sanders.